wanted to introduce myself. My name is Alan now. I'm one of the board members of the ISCPH. Filling in for Melanie. She is here in spirit, and I see she's logged in also. But just a reminder that this is going to be a recorded session. There's going to be time for questions and answers at the end. But since it's a little bit smaller group, I feel like this is going to be more of a discussion than a little free-for-all, as you could say. So with that, I'll let Mindy introduce herself.
Okay, should I start my screen share though? Is that okay?
Yeah.
Just 1 second. So my name is Mindy Madeo. And okay, so yeah, my name is Mindy. I'm gonna be telling you guys about Utah's medical cannabis program. I graduated from the University of Utah many years ago, 2002. Feels like forever. And for those 20 years, I was a pharmacist. I was mostly in retail. I had a few clinical positions like scattered in there, but I did move around from different states. I practiced in Colorado as well, in Denver, and in St. Louis, Missouri. So I've been a pharmacist in 3 different states at a variety of retail locations. And right now, and I actually was retired. I quit pharmacy about 3 years ago. I got to a position where I kind of felt like I wanted to retire, was kind of frustrated with healthcare, medicine. And then as soon as I heard about this opportunity, I actually jumped completely back into work. Had no idea I would be this interested in cannabis, but so it's been quite the change for me. So probably the last 2 years, I have just learned everything I could about cannabis. And then I put my email down here. So if you guys have any questions or want to connect, you could send me an email. So Utah's a unique state, and some of the things that people identify with, we're very known for our skiing. We've got a lot of visitors here for our ski resorts. We also have a lot of national parks. Tourism's our the number one money maker in Utah. And there's also, if you guys don't know about Utah, Utah's a very high percentage of people in Utah are LDS, and they're very conservative people. They've got, so when we passed a lot of these laws, we did have to work with the church, the LDS church. And they even go so far as to, they've put out statements saying medical cannabis is okay, but vaping is not, which kind of conflicts with some of the state laws. So it's something we do have to kind of like keep in mind. It's a very conservative population over here. But that being said, we are seeing all different types of people in our medical cannabis program, many LDS people as well. So this is just the outline. I'm going to talk a little bit about what a patient needs to do to get a card in Utah. And then I'm going to go through the snapshot of the program and my role as a pharmacist. And I'm going to lastly tell you about some resources that I like. I love it when other pharmacists talk and they tell me they recommend books or resources or websites that they use. I think that's really important for us to share that information. So the patient certification process. So this is a very new program, and the law was passed in November of 2018. The first pharmacy that was up and running was open in March of this year. And so my pharmacy that I work at, we were the 4th pharmacy open. There's been a lot of changes. So even though the laws are written, a lot of the ACT rules are kind of being built as we go. So a lot of what we're doing gets changed a lot. It's frustrating, but it's also exciting because we can help guide the program a little bit. So a patient, to become a medical card patient in Utah, you need to meet with the doctor, which we call the doctors the QMPs, qualified medical professionals. They can be an MD, nurse practitioner, PA. So the patient will meet with them, and they, unfortunately, it's kind of a costly program for our patients. They usually have to pay a $300 fee to see the QMP if they don't have insurance, which many don't. And then once they sign up for the program, it's a $15 fee to get the card, and then $5 to renew. And the renewals right now are quite extensive, I think. So you get your card, then you have to renew it 90 days, it's 6 months, and then a year. Then after you've been in the program for a year, it's a yearly renewal. And each of those renewals, they're required to go see their doctor again for a follow-up. Another thing, so the limitations on product. So, and I think these actually are quite high limits. So a patient in the Utah program can have 4 ounces of flower and plus 20 grams of additional processed THC. That's per month. The doctors or the providers can place more strict limits. So some doctors will say this patient can only get 1 ounce of flower. But unfortunately, our software is so, it just doesn't work. And so we've got the situation where the doctors are placing these some of the doctors are placing strict limits, and it's really difficult for the pharmacies to comply. So I would be interested if any of you guys are in other states where this is working well, like maybe let me know like what software you guys use. I've had quite, there's been a lot of issues as well with the State Department really wants the providers to put these real specific dosing too. Like they would prefer that a provider would say like take 20 milligrams of THC QHS. And they've even gone so far as to write in some of their laws partial fills information. So really, according to my Utah state law, if a doctor has authorized a certain amount, I have to almost treat it like a partial, like if they didn't pick up the month supply, they have to come get the partial fill later. And it's not applicable to cannabis medicine. So we've got a lot of like arguing and fighting with the state. Because I feel like the state of Utah is really trying to make this program prescribatory. They want the providers to prescribe something just like they were at Walgreens, just like a traditional pharmacy. And it's just, to me, it doesn't necessarily work with cannabis dosing. You need a lot of wiggle room for the constant patient adjustment that the patients need to be doing every day. So there is plans to be, we are going to be able to accept other state medical cards sometime next year. They just haven't written the rules, the act rules for it yet. There's a lot of things that still need to be ironed out. My company is working on delivery. We just got that approved. So now we're able to do delivery. We're also still trying to figure out how to work with nursing homes. Right now, you can be a patient, but if you are not the person that's actually coming to the pharmacy and picking up the medication, you need a caregiver. You may only designate 2 caregivers, and these caregivers have to go through a background check. It's quite extensive. So we've got this gap in nursing homes and like care centers. The state needs to figure out a way to allow cannabis medicine to be used with those patients when it's a facility, like be able to allow one person to be a caregiver to many patients. So there's still a lot of bugs to work out. And here is our qualifying conditions. I think the qualifying conditions are very similar to most states. One thing I'll tell you, the majority of patients, I think it's almost like 70% of the patients, their qualifying condition is pain. So if you look at the bullet point that's second to the bottom, it's pain lasting longer than 2 weeks that is not adequately managed. And then it says, despite attempts using conventional medications other than opiates or physical interventions. So most people use pain, but As a pharmacist, I would say that a large majority of those patients are really there for anxiety or sleep. We're currently talking to legislators right now, trying to add sleep as a qualifying condition as well. And I have seen, going through these, I'll tell you, I've seen cancer, I've seen nausea, definitely seen Crohn's, epilepsy, MS. PTSD is probably the second most common qualifying condition. And you'll notice that with PTSD, you have to have a certain provider, like a psychiatrist, be the QMP. So there's a little bit additional qualifications for that QMP that you need with PTSD. Autism is probably where I see most of my children that come in. So there are a lot of kids in Utah because of a lot of LDS people in Utah have large families. And I would say that our autism spectrum disorder rates are quite high. And so it seems like most of the moms I see with children are there for autism. I actually don't see very many epilepsy patients. I do believe that maybe they're getting like CBD products elsewhere. Right now, our pharmacies are so new that we don't really provide a lot of CBD products. We're starting to add that, but it's complicated because anything we sell that is just CBD still needs to go through the state testing, get a COA. And right now we only have one lab. They just opened up a second one, but the lab testing is so slow, so cumbersome that it's almost easier for a patient to go buy CBD elsewhere. But I'm hoping in the future we'll be able to be like a more trusted source of CBD. Yeah, and then there's also at the very bottom of the qualifying condition, we have a compassionate use board, where if there's any condition that you feel like is not on there, but you want to use cannabis, you can go in front of this compassionate use board and state your case. And the people that have done that, it seems like most of them do get approved. Let's see. So here's the process for the provider. So the patients need that QMP to give them a card. And that QMP has got a bit of work too. They need to enter a dosing recommendation into EVS. And this is where the state of Utah, at the very beginning, they were very specific about, they wanted the doctor to say exactly what dosage form, exactly the milligram, exactly like how often they are to take it. And they also, and if the provider, if the QMP decides they do not want to issue a specific recommendation, they just need to upload a med list, and then it's the pharmacist's responsibility to add the dosing recommendation. So the last couple months, they were having the pharmacist enter these real specific recommendations, but I still don't think that they're very accurate or they're very applicable because of the uniqueness of the cannabis dosing. I really have been, like I said, I've been trying to get the state to change that, and we're working on it. So right now, at the point that they said we don't have to put the specific dosing, but we do have to put limits as to how much they can get per month and which dosage forms are allowed. So we still have to like do a lot of paperwork, a lot of data entry into a computer, both the QMP and the pharmacist. So how people find their QMPs, they can go into the Department of Health and there's a list of QMPs. So they must be an MD or PA or nurse practitioner. Pretty much anybody who has a controlled substance license in Utah can be a QMP. They just need to take 4 hours of CE and pay a fee. But another unique thing that I'm not sure if other states have this, there's a limit on how many medical cards each QMP can recommend. So if you're an MD and you've got some additional, I think you have to be like a pain specialist, or there's certain specialists that they will allow those MDs to give 600 medical cards out. Everybody else is about 275. And the reason, the Utah's reasoning for doing this is they didn't want a program where there's these cannabis specialty clinics that really advertise so that anybody could get a card. They wanted it to be more medical. The state of Utah really envisions everyone getting their medical card from their primary care provider. And I somewhat disagree because I do know a couple QMPs that are just amazing. They're specialists in the cannabis field. They are who I would want my friends and family to go see if they were going to get a medical card, because there's some QMPs out there that just do a fantastic job of education. So, and unfortunately, those QMPs have hit their limit. So they are capped out already. They're unable to see any patients. So right now we're kind of at this weird, and this is actually going to probably be brought up before the legislature in March. A lot of people do want it changed. I think it could go either way. The state wants to keep the cap, the limits. A lot of people want to take them away. I really hope it's gone by the next spring, but we'll see. Okay, so these are the products that you can purchase in Utah. And since we're a new program, everything does need to be, of course, grown here and processed here. We do not have any tablets on the market. I do have one capsule. It's getting poor reviews though, so I never recommend that. And it's also a 14, the only capsule I have available in my pharmacy is 14 milligram THC, and I feel like that's a little high to start a lot of people on. Concentrated oil, we do have the vape cartridges, and I like the vape cartridges, but there's some that I'm a little bit more concerned with because they do use MCT oil in them. So I'm really trying to get the processor to change that, and I think they will. Liquid suspensions. So we have tinctures too. We have tinctures, sublingual tinctures, and those are very popular with the QMPs. The doctors love the tinctures. I do as well. We do have creams. Gelatinous cube. We are not allowed to use the word gummy, which is so funny. So when I'm talking to my patients, I have to try not to use that word. None of the packaging can say the word gummy. It has to be a square shaped. There could be no other fun shapes or nothing like that. And we do allow flour, and that was a big, huge fight. They almost said no to the flour. Flour is definitely our highest seller. That's what most people use. Most people buy. Right now, most of the pharmacies are almost completely sold out. So we're just kind of waiting for some new supply. In Utah, you are not allowed to smoke it. And I think that's like that in other states. So we sell a lot of dry herb vaporizers. And I think that's a great dosage form. There was a funny thing also in Utah where when they first passed this law, they wanted us to put the flowers in blister packs. So we would have to like get little amounts and put them in each blister, like a daily blister pack. And we just barely got that changed before the pharmacies opened up. So we were thinking we were gonna have to do some weird, anyway, luckily that's changed. We can do concentrates. We've sold a couple of real good quality hash rosins, and yeah, and we can do medical devices, of course, too. So here's like our program snapshot, like our stats. So right now, so this is as of August 31st. So we have about 10,000 card patients, and the state reports that there's about 4,000 letter patients. And I guess we'll have to explain what the letter patients are, because this is a very confusing part of our program. The card patients are patients that have gone through the system and been approved. Utah passed something saying if you could get any doctor to write a letter saying cannabis was okay, they didn't have to be a QMP. And these letters were just meant to get us through till we got our dispense or our pharmacies up and running. And the letters, they actually allow you to go across state lines too. So you're able to go to Nevada, you're able to go to Colorado, purchase product. As long as you have a letter, you will not get in trouble in Utah. But the letters will actually end the very end of the year. So at the end of the year, all these letter patients need to get back into the card program. I've got a lot of letter patients who feel they're weird about getting in a government system, so they say they won't. So I think a lot of the letter patients won't get cards, but I would say there's way more than 4,000 letter patients. There's no way to track it because we don't know how many doctors are writing letters. So and I've heard people say upwards of 10,000 people probably have letters too. So that's going to be interesting December when all those letters are no longer valid. So we'll see what happens. So as far as the demographics, majority of the patients in the program are male, it's 55%. And the age bracket that seems to be most popular is this 31 to 45. So there are 446 QMPs, which I think is a great number. I feel like that's good. We do have a lot of these doctor clinics, these cannabis only clinics, where because of the caps, there'll be one, maybe like a doctor runs this clinic, but then he'll hire all these PAs to work under him, and he'll just hire them, use up their cap of the 275, and then go on to the next PA. So this idea of the caps is not really preventing what the state wanted to prevent. So there are a lot of these clinics. It's very, very easy to get a card in Utah. You can go to any one of these places, pay $300, and get a card very easily. So there's eight people that are allowed to cultivate. And my company, Wholesome, is one of the 8. And right now, I would say there's maybe only three to 4 people that are growing flower and providing it to us. So which is why we have such the demand and inventory. There's 9 total processors. And the processors, they didn't give a limit on how many processors can open up. As long as you have the money to open up a processing facility, you may. And so then there's 14 total pharmacies that were allowed. And so they gave 14 licenses throughout the state of Utah, gave you kind of like an area where you can operate. Like for my pharmacy license, we were in a certain county. There's one like in southern Utah, there's a couple in Salt Lake. So right now there are 6 out of the 14 that are open right now. So, and I did mention the lab testing. So everything does have to go through many rounds of lab tests. Like it's kind of ridiculous. But it's slow. So unfortunately, it feels like a lot of our flower is quite dry by the time we get it. We hear that a lot. And right now there's no terpene testing. I really wish that I had the terpene profiles to help. I just think it's medicinal, and it's also like a good way to distinguish between the strains. And I would love to be able to highlight that with patients. So in the program, so out of these 6 pharmacies, there's 23 pharmacists. My pharmacy has, I'm the pharmacist in charge. And then I've got a partner who's a full-time pharmacist. And then we also employ 5 remote pharmacists who have other jobs, but they just work from home. It's actually a pretty good gig. I almost kind of wish I did that. And I think the other pharmacies are the same, the other 6 pharmacies, where they have a couple that work at the store every day, and that some that do remote consultations. And the reason we have remote consultations is because sometimes, especially in the beginning, you have so many people. If you're going to sit down for 20 minutes with each person, you just really need to be able to hand it off to somebody else. And so right now in the program, there's 64 agents. Utah really likes to have medical terminology for things. So we do not use the word dispensary. We always use the word pharmacy. We don't use the word bud tenders. We use the word agents. They specifically outline certain words we can't say. They don't like us to say the word high, the gummies. I told you they won't let us say that. So it's kind of funny. It's really hard to balance. So I've got a pretty medical background, but a lot of my agents are very almost rec. So it's really hard for me to kind of like find that balance between serving a population that's kind of more rec-like and one that's more medical. But I definitely pharmacy does try to be much more medical. So this is my role. This is kind of like what I do every day. So I already mentioned this, that every cannabis pharmacy has a pharmacist, and the pharmacists are called PMPs. We have to be on site. I can't even leave necessarily for a couple hours. It's just like a traditional pharmacy. We have to, they also say something in the law, how we have to have some sort of way for the patients to contact us. So I've got an email that patients will send me questions. Also, I've got I've got a phone and they leave voicemails, and a lot of times I'll call them back. And so during my day, I'll do consultations, but I'm also doing a lot of follow-up questions. So the PMP is responsible, my main responsibility is to consult with the patients, recommend the cannabis dosing guidelines. And I'm pretty specific. I do like specific dose, like starting doses. But I just don't like to control someone to have them stay at a certain dose. I like patients to have the ability to dose up or dose down based on effect and strain. And another issue with this specific dosing too is with our inventory, we often get so many different things from batch to batch. We don't have consistency in cannabis products. And I think that's a problem that's never gonna 100% be fixed, because I think the nature of cannabis, I don't think you have consistency really at all. I mean, if you took the same plant and took something from the top of the plant and took a flower from the bottom of the plant, it's going to be different. So the state does require that we do a consultation for every new patient. Right. So right now, this is one of my projects that I'm working on, is we're trying to figure out the pharmacist follow-up. There's really no guidelines for what the pharmacist does as far as follow-up. My pharmacy, we're going to go ahead and do follow-ups, like we'll call certain medical new patients just to check in on them. But I'm hoping that there is some legislation changes where a pharmacist is required to almost consult with the patient maybe once a year, just to see how things are going. I think that pharmacists, especially pharmacists in Utah, are probably the perfect position for data collection. If we can get to a place where we see the patients initially and then follow up once a year, I can just see that would be a great tool to collect data. And I would love to, I need to figure out how to get on someone like a research group to help me with an IRB and to help coordinate some research data collection, because I'd love to be involved in that. So to be a PMP, you just need to be a licensed pharmacist, and you actually do the same 4 hours of CE that the providers do, the QMPs, and you do that every 2 years. I will tell you too, as far as pay, I feel like that most of the pharmacists in Utah took a huge pay cut to be cannabis pharmacists. So we definitely, it seems like all the pharmacists that I've worked with have a lot of good reasons to be in this industry. It's not very lucrative compared to things like retail. So I just wanted to show you what my pharmacy looks like. So you'll see a picture of the outside of the building. We're actually right next to Costco, which is kind of cool. I feel like we're not in a seedy part of town. We're right off the freeway. We've got a great location. And then I've got a picture of, those are some of my agents, and that's what our facility looks like. The state does require us to lock up all of our products. You'll see those glass things that's nothing can be out in the open. So, and it has to be locked in a cupboard behind. So we'll describe things to the patient, just show them in the glass case, and then we'll go unlock the cabinet and get it out for them. And the bottom picture is a picture of my office, and that's just a picture of, it's kind of what the consultations look like. I said, I spend probably 20 minutes. Some patients are shorter than others. It just depends. And yeah, that's my favorite part of my job. And I don't ever want to not be doing consultations, because I think it's super rewarding. Okay, so some of the resources, if you have any questions about Utah specifically, the utah.gov. So Utah's, our program's run by the State Department. So their website has some really good information. Any information about my business at wholesome.co. And again, there's my email address, or if you wanted to connect in LinkedIn, I would love for you to do that. And some cannabis resources. Oh, so I'm also in grad school right now. I just started the master's program for cannabis science and therapeutics. And I really love the program. I wasn't quite sure if it would be good. I wasn't sure like how academic it would be. But me, and then also one of the QMPs that's like a triple board certified pain doctor, we actually are both going to this program. So, and really it's been great to connect with her, because I feel like we bounce a lot of things off of each other. So, and she also really likes the program as well. We've only finished one class, so we've got a full 2 years. And then I took some pictures of these are some of my favorite books. I don't know if you guys have read the Bonnie Goldstein Cannabis is Medicine. It just came out a couple weeks ago, but I really like her. I think she's a wonderful. I also really highly recommend Patricia Fry. She wrote that one on the left, the medical marijuana guide. She is fantastic. And that cannabis pharmacy one I read, that's great. And over on the right, Ruth Fisher. I think she's someone I really respect, and I like her information. And then I use this medical cannabis handbook. It has a lot of posters, and a lot of times I mark things and I'll show them to patients. So I use that one a lot as well. Okay, and that's it. Do you guys have questions?
All right, sorry, I forgot to mention at the beginning of the lecture, or please type your questions as you go along, but yeah, it's essentially an open forum now.
I get a question.
Yeah, Jill.
So will
Okay.
you go
Go ahead.
back to your the competency exam or CE that's required of the pharmacists in Utah?
Yeah. So it is 4 hours. So to be a pharmacist, a cannabis pharmacist, you do 4 hours of CE, and the CE is actually put on by the state. And I think when I did it, they only had like 3 or 4 options. I remember marijuana 411 was one of the options. The local university, the University of Utah, was one of the options, and one of the medical clinics. I think it was IHC or Select Health, you could go and do a seminar day with them. So there wasn't very many options, and they're all approved through the state. And I'll be honest with you, none of them were good. They were very one-sided. They were very much like, oh, these are the dangers of cannabis, and it wasn't great.
So does the University of Utah, that's where you went to pharmacy school, right?
Yeah.
So do they offer a course for their students there?
Nope.
No, they just offer a CE.
No, they're actually not entirely on board, or they're on board, but they just don't know how much they can. There's 2 pharmacy schools in the state of Utah. There's Roseman University and the University of Utah. And I have reached out. I've talked to the state about getting interns from both those programs, but I just don't think they know how much they can be involved. It's really scary for, I think, a college to be involved in something like this because of federal funding.
Right.
And so, yeah, I really don't get any resources from the local colleges. And if anything, I would say that a couple of their physicians and a couple of their professors at their medical school are very critical of the program. And we butt heads a lot, honestly.
Yeah. So are the CE programs sanctioned by your board of pharmacy in the state of Utah?
Yeah.
So that's where if they approve it, then those are the courses that you can use.
Yep.
Okay.
I have a question from Lizzie. Does the proposed reciprocity include new purchases or purchases and use?
I'm not sure. So I'm not sure, to be honest with you. I think what I heard that they were proposing is if you had a medical card from another state, you were allowed to purchase 2 items within 90 days. That's all I heard. And that was just thrown out by the head of the health department. I don't know if that's gonna happen.
I think what she was referring to is maybe the statute of consumption inside of Utah as well.
Oh. Yeah, so if you are consuming, you mean if you're consuming product from a different state?
Right.
Yeah, yeah, so it's one of those things that, so they just said that their law enforcement will not enforce you, I mean, if you have a letter, you're able to consume, yes, you are able to consume, and you are able to transport product from these other states. So, but again, that ends that, but it does say you have to be within the limits and the dosage forms. So if you were to go to another state and purchase a dosage form, like a cookie or a drink or something, that wouldn't work. It has to follow our rules. And they did that just because we didn't have the product inventory to help the people in the very beginning.
That's really interesting. So that you're saying that they are okay with transporting it across state lines?
So yeah, that's cool. They don't say that, but yeah, I mean, because that's breaking such federal statutes,
Right.
right? I
Right.
mean, when I counsel to patients, I usually say, Utah will not prosecute, Nevada will not prosecute, Colorado will not prosecute if you have products from these other states, but crossing that state line, you are running the risk of federally breaking the law. So, but I
Gotcha.
think that the police force, they're not going to sit at the borders and pull people over. Like, or if they do, they'll say, "Can I see your letter?" If they have the letter, then you're off the hook. So, for what I understand.
And to kind of follow up on that question, one of the biggest questions that pharmacists and medical professionals in general have, we kind of touched on this in Pennsylvania's state series last month, but the idea of having insurance, liability insurance for malpractice. What are your thoughts on getting personal insurance? Does your company offer any kind of liability insurance as well?
No, I mean, from what I understand, when I was a pharmacist, I was always really careful to have malpractice insurance, but right now, I don't think a malpractice insurance would ever cover me. I can't, it's so hard even to get like banking to cover, certain things. I think if someone, and first of all, too, I also think cannabis is a very safe medication. But I do think that if someone were to sue me, I think you could say, oh, it's illegal. You shouldn't be using it anyway. You know what I'm saying? Like,
It's the
no.
catch-22.
Yeah. Do you guys know? Are there pharmacists being with malpractice and doctors? I just don't think you can go there because it's federally illegal.
This
Yeah.
is Samantha. I've actually talked to Shane Carmichael, who is
Okay.
a consultant who's in this group too, but he's not here today.
Yeah.
I talked to him a few months back and he said his liability insurance was like $4,000 or something. So he has it, but it's very expensive. And I'm actually going through the process of trying to figure it out myself. So I'm so glad you asked that question.
Yeah, and this is the I think I was on the call with Shane as well. But he has his own consulting firm, so it's a little more individualized because it's his singular business versus you are essentially working for a company.
Yeah.
Um,
My company has it. I know my company does have insurance, and they talked about, I remember them saying that they have insurance for, say somebody drives away and they consume cannabis and they drive and get in a wreck like a block later. I think that we do have insurance that covers that if there's litigation towards us, but it's just as my company. I don't think, and maybe it'd cover me. I don't know.
okay. Yeah, and this is our industry. It's a very gray industry. So I
Kind of
have
like,
another question.
yeah, it's like the Wild West, I think.
I have another question from Lizzie. Says, what business structures are common for pharmacies, cultivators, processors? Are multiple entities common required?
No, so in Utah, there's only 3 companies that have vertical integration. So, and that was it was kind of like a rare thing for the state to allow you to cultivate and to have a pharmacy. So Most of the pharmacies don't have a grow or a processor, and vice versa. Most of the grows don't have a pharmacy.
Okay. I have a question on logistics. How does 6 pharmacies service a state that's 90,000 square miles?
Yeah, it's difficult for sure. Like in southern Utah, they don't have access, but I've had people drive 6 hours to come up to my dispensary or my pharmacy. And because of this, we're hoping to get the 14 pharmacies up and running. They said that the state said you have to at least have started construction by the end of this year. So hopefully we'll get 14 fairly soon. But my company is really pushing delivery, and we're actually we're probably gonna get our delivery license next week. I imagine we'll be able to deliver within a month. And so technically, I mean, we could, if we got enough people from southern Utah, we could run a driver down there and deliver. And I think all the other pharmacies will probably follow suit with that business model as well. We're trying to think convenience. I think everything with COVID, Utah's in such a cool spot, because really the QMPs, they're actually they're working on legislation so that the QMPs can do remote consultations. The pharmacists can do remote consultations already, and then the pharmacy could deliver. So a person could just be home and everything is brought to them. So that's kind of what we're going for.
Cool. I have a question about the medication side of things. I'm personally in New Jersey, we don't have concentrates available to medical patients. And there's a very specific and unique need for such high levels of THC. Do you think what we know about microdosing of THC and CBD, that concentrates are for the medical market versus the adult use market?
I will be honest, I don't see much need. I don't see a situation where I've never recommended a concentrate. And I do know that I think that was just kind of a lapse in judgment by the state.
Right.
I think it would be better that they allowed drinks rather than like wax and rosin, but it's, and we called this Utah program medical, but there's definitely a lot of rec that, I think every state's got that just has medical. You see a lot of rec use. As far as concentrates, one thing I do like about concentrates, I think that their extraction process is very clean. I feel like if you wanted a product to include all the cannabinoids and terpenes and some, at least in Utah, the way they extract some of these concentrates is a little bit better than anything else processed. So, but yeah, I think it's a rec product.
Yeah, and especially given that your state doesn't allow smoking or doesn't support smoking.
Yeah. So that's the other gray area. So you think about, you've got to concentrate. And I don't know much about it personally, but from what I understand, you need a heating element. You've got it, and sometimes there's a torch and a nail. And I feel like sometimes that you are going to use a flame. And I also feel like the whole reason the state doesn't allow smoking has to do with the temperature being too high, where it burns off a lot of the cannabinoids and terpenes it use. And so I feel like if the state really looked at like the dab rigs and stuff like that, I think they would say, oh, that doesn't fly either. But it's kind of this gray area. We actually don't have that. We only had one batch of concentrate. Our pharmacy sold it, and it sold out super quick within days. And none of the processors have been able to take any flower and create any product that's passed testing yet. And they've been working on it. So the one thing I want to see really, like if I could have my wish list for a processor, I need some RSO oil. I think that's something I can see it with the medical use for sure, the Rick Simpson oil. And I've actually sent some of my cancer patients across the border, and I'm like, you go buy some of this, because I know we don't have a product to meet their needs.
I had a question about the equity of it, because I'm seeing which counties are actually covered. And I'm also seeing that San Juan County is the most poverty ridden, and there's no providers in that area, even QMPs.
I know.
So is there like anything that you were thinking of putting into the law as far as like how it
Yeah.
can be more equitable down south or even up north? Because I saw Weber County too. It's a small county, but
Yeah.
that's pretty poverty ridden too.
Yeah, you know, I live in Weber County, and it's one of those things, and a couple of my agents, they are from, their parents are undocumented and Hispanic families, and they can't be in the program. Like they're, it's just too scary for them to be, well, and first of all, to have to pay $300 each visit to a doctor, where you have to renew your card every like 6 months, or 3 months, 6 months, and then a year, is just excessive. There's, so the legislation, as far as making it more accessible, that they're trying to change some legislation for the QMP follow-up. So they're going to try and lower the amount that these patients are having to pay to QMPs. We as a company we're creating this scholarship program where we're able to donate a percentage of our proceeds to patients that need help with paying for medication. And I think right now, you know, our prices are pretty expensive. An eighth of flour is about $60. So it's hard to buy that. And it's so, to me, it's so frustrating too, that I've got these patients that come in, and I just want to help them come off all their medications, all their pain pills and their sleeping medications and their Adderall, and there's so many medications that can be replaced with cannabis, but their insurance will cover the medications, and cannabis
Exactly.
dollars a month. And it's like they would feel so much better. I don't see, to be honest with you, I hate dealing with insurance companies. I don't ever insurance companies part of the equation. But one thing we did also have in our law is we used to have home grow. I would love it if home grow, it might hurt my business, but I think it's the right thing to do, to allow somebody to grow their own product just for their own personal use.
Yeah, definitely. And then I had another question as far as collecting data. I know you were saying that you all were trying as far as so do you think that's going to fall on the pharmacists to collect that data? Because it's such a shame, like in Colorado, Washington, Oregon, where we could have been collecting so much data this whole time and we haven't been. So do you think, since Utah has such stringent follow-ups, this is actually a great opportunity to collect data?
And that's why I'm scrambling, because so I run the Pharmacist Association in Utah. So I'm kind of like I work with all the other pharmacists in Utah, and nobody knows how to collect the data. So I really need someone from another state to come in and help us set something up that's a good study design. And any medical data you can think of. It's like I've got these patients coming into my office, and if we could also get the follow-up, it's like that would be an ideal study design. And I think the pharmacist collecting the data would be best, because it's medical information. We protect a lot of the medical information in Utah kind of belongs to the pharmacist. So my agents are not really allowed to discuss medical treatments. They also do not have access to the system where the patient is, where the doctors, all the doctor information and the history and med lists. Nobody can see that information except for me. So I think it will fall on pharmacists, but we have to just be very careful about protecting patient information too. So that's what I'm trying to figure out.
That makes sense. And I'm actually taking the Coursera course with CU Boulder with Kent Hutchinson.
Yeah.
And he seems like he might be a good person to reach out to.
Yeah. What's his name?
Kent Hutchinson. And he's actually one of the people on the board. And it's in that book. It's like the Bible of the small amount of research we have. What is that called? Oh, I forgot which book it is, but it's just like that review panel that took all the studies that they've done and just
2017.
Yes.
I know exactly. I have it in my office. Yeah.
Yeah, it's in my office too, so I don't see the title.
NASM, right?
Yeah.
Yes.
It's got like
yeah, and he talks a lot about that. So he might be like a good person to consult about that. And he has like a whole bunch of researchers on there too, like Ziva Cooper, and I forgot who else, but I think this is a perfect opportunity, because you have to make the patients come back. So it's cool.
I'm kind of, I want to do research. I'm excited about it, but I also see the limitations. You know, I think even with the best designed, the best study design, there's so many issues with cannabis and research, and it's not just like legalities, but it's the inconsistency with the products and the how everyone reacts so different. You know, you've got a substance with 400 plus chemicals. It's really hard to control for all the variables when you're giving somebody that substance. When you have morphine or you have opium, it's just one molecule. You can research that so much easier. So I definitely want to be involved in research, but I see how frustrating it might be to set up something that's good. That's why I need help.
Mm-hmm.
I share the same sentiment with everything you said about research. We have a long way to go from cannabis being a streamlined kind of standard of medical care, but it's got to start somewhere, right? Like that's why we have pockets of people that are in this program for the right reasons, and they're going to be the one that we rely on to give us the data. I'm referring to patients at least. But yeah, study design, that's something that we can maybe talk to Melanie about, see if we can head a department up. Pharmacists are in a unique role because we are usually the front line of medical cannabis dispensaries. However, physicians on the other side of it don't really get the same type of interaction as the normal patient prescriber model.
Yeah. Well, and it's funny because in my company has spent a lot of money. They'll hire these like statisticians and all these there's like 2 people that work for us that are looking at the patient demographics, and they're doing this to almost like target them. But I'm like, I could use them. Like I just, if I have to figure out how, like to me, I see some synergy that I've got these people on my team that are collecting this data, this information. The thing they're not allowed to collect is the medical data. So I want to be able to collect the medical data. They can help me with it, or they can, do you know what I'm saying? Like, I feel like I'm so close to like being able to do this. I just need like a researcher to help me organize it.
All right. So to kind of wrap it up, I'm not sure what time this is supposed to end, but I think we're probably at the 1 hour mark. So I'd say that's a good marker. How can we reach you, Mindy, if we have any follow-up questions?
So my email, it's Mindy at, let's see, it's over here. So it says Mindy at wholesome.co. That's CO. You could also search for my name. Here's my full name. You could connect with me on LinkedIn. So my last name is Medeo, Mindy Medeo.
Great. Okay, thank you so much for taking your time out, Mindy, and thank you everyone else for participating. Next month's series is about Connecticut, which they're also in a very unique situation where pharmacists are required to be on staff. I know that for a fact. So if you want to tune in, I don't know the exact date, but I think it's the first Tuesday in November. But I'm sure it'll be on the website. All right, thank you guys so much for joining.
Hey, thanks guys, appreciate it.